To test for BVD-PI animals is relatively simple. All that's required is an ear notch sample, and as soon as you take that sample, refrigerate it, send it to the lab facility, and within about 1 working day of when the lab receives it, they will issue results of whether you have a BVD-PI animal on there or not. And if you look at the expenses a PI animal can cause in the group, the cost of testing is minimal. If you choose to test these stocker calves, our lab will supply you with everything you need for sampling and the information you need for shipping. We'll send you out a tray that has vials on it. The vials will contain what's called an extraction fluid. All you need to do is, as the animals are being processed through the chute, take a simple ear notch sample with a standard pig ear notcher that we can provide you. Put that in a vial that contains the fluid, identify that vial with the individual identification of that specific calf. Keep that chilled until you're ready to send them off. Send them off with a cool pack in the shipment. Send them to the lab, and within 1 business day you will be issued results as to whether you have any BVD-PI animals in that group. It's important to note that because BVD is such a highly transmissible disease that you need to take some precautions as you're taking the samples. And what we need to do here is, with the notching device, it's important to disinfect that notching device between animals. Not that it will affect the test outcomes in any fashion, but we do not want to spread BVD from a PI animal to the subsequent animals that are coming through for processing. So it's important to disinfect that ear notching device between those animals. The other important thing, if you want to talk about transmission, is any device you're using in or on an animal should be disinfected between those at processing. Dehorners, implant devices, taggers, all those can transmit the virus from a PI animal to the subsequent animals coming through the chute. So sanitation of everything is vitally important.